Medical surveillance must be provided in a convenient manner at no cost to employees. For employees who are or may be exposed above the action level 30 or more days per year, or who are experiencing signs and symptoms of exposure, or who is exposed in an emergency, it must be performed by or under supervision of a professional licensed healthcare provider. Medical exams must be provided within 30 days of initial assignment or equivalent exam in previous 12 months. Must be provided annually, within 30 days of healthcare provider's written recommendation, when an employee shows signs and symptoms of exposure, within 30 days of exposure associated with uncontrolled release, and at termination unless examined in the prior 6 months. The medical examination must contain the following: a medical and work history, including past, current, and anticipated exposure, respiratory problems, asthma, dermatitis, skin ulcerations, and nasal septum perforation, smoking status and history, examination of the skin and respiratory system, and other tests considered necessary by the healthcare provider. The employer must ensure that the healthcare provider has a copy of the standard. They will also be provided a description of previous, current, and anticipated duties as they relate to exposure, a description of personal protective equipment, including time and duration of use, and any information from previous work-related examinations if available. The healthcare provider must have a written opinion within 30 days of examination that includes the following. First, their opinion of medical conditions that increase risk to health when exposed, any limitations pertaining to exposure or protective equipment use, and a statement that the exam has been explained to the employee. The healthcare provider must not reveal findings or a diagnosis that is not related to exposure to the employer. The employer must provide a copy of the opinion to the examined employee within 2 weeks of receipt.